Have you recently received an MRI? Well, as we're starting to see more patients in the office, I'm seeing patients bringing in quite a few MRI reports, which are great. MRI reports are important and helpful information. But however, we want to make sure that we think about it clearly and put it in its rightful place. So I call this the MRI Dilemma. So an MRI is used to get an image of soft tissue, of ligaments and your discs and muscle tissue, versus an X-ray. An X-ray is going to just give you a picture of your bones, so your skeletal system. So the MRI is helpful, but not always pertinent or related to what you're having or what you're experiencing. So here's what I mean. An MRI report will list out all the structural things that the radiologist sees on the image. So we'll have lots of terminology like osteophytes and disc herniations or desiccated discs, or just there's a slew of terms that will be listed. And the way I think about it is, if you've ever gotten a home inspection report, it kind of reminds me of that. We recently, about 2 years ago, purchased a home, and we got a home inspection, like most of you probably have. And on the home inspection report listed all the things in the home that you could possibly find with the eye. Meaning, we had things like baseboard is warping, or evidence of standing water in the basement, or the gutter is filled with leaves, or the chimney is dirty. All those things are good and helpful, but we still bought the house. Similarly, on the MRI, the report is all the visual things that a radiologist saw on your image. The dilemma is, what is pertinent and what isn't? What parts of that report is what's bringing you in to physical therapy, and what are just kind of normal findings or insignificant findings? So what we try to do in physical therapy is we look at how you are presenting. How are you moving? How is your strength? And most importantly, what is the problem, the main problem area? So a lot of you have pain. So what is this pain or movement restriction or strength loss causing you to miss out on in life, or having difficulty in everyday life? And we try to focus it around function with the MRI in mind, knowing that these things are structurally in there. But again, we have to put it in its rightful place. The MRI is not the diagnosing report, it is just a findings report. We have to now figure it out and put it together with how you're presenting. What are your problems? So I hope this helps. If you need any help with an MRI that you had, or you could use some physical therapy, come on in and see us. We'll see you next time.